morning. Okay, my name is Mesfin. I am a presenter from Group 3. Our title is Fracture in the Wind Dressing. First of all, thank you, Mr. to give these chances for me. When we start from our topic, what is our course, our title, our outline is anatomy in the definition of fracture, types of fracture, cause of the clinical manifestation of fracture, diagnosis of fracture, management and the nursing intervention for fracture, complication of fracture, and also our learning objectives. At the end of this presentation, we will try to understand, differentiate anatomy and the physiology of the bone, define the fracture, differentiate types of fracture, list cause and the clinical manifestation of fracture, explain management in the nursing intervention for fracture, list complication of fracture. The second our learning objective is depend on the case, wound, definition of wounds, classification of wounds, ways of wound dressing, wound debridement and its types, suturing type in the materials, and also nursing diagnosis intervention for wounds. When we come to bone structure or anatomy of bone, all bone consists of densely solid outer line known as compact bone and the inner line spongy bone. The outer line is compact bone and the inner part is the spongy bone. And also bone is extremely dynamic tissue. When we see the types of bone, we may classify bone for categories. The first one is long bone, the second one is short bone, the third is flat bone, and the fourth one is regular bone. When we see long bone is most of the time found on our extremity, lower extremity, and the upper extremities. Also short bone is the bone of our wrist and ankles, and also flat bone is the bone which found just like our flat bone is sternum bone is one example of flat bone is. And the fourth one is the regular bone. Regular bone is the bone of intracranial bone is all intracranial bone is regular bone, and also bone of our shoulder regular bones. When we see about the functional of the skeletal system of the functional of the bones, bone has many functions. When we see one by one, the first one is support of body position, and also promote mobility to move, and also protect underlying soft organs such as lung, kidney, liver, and also other organs, soft vital organ in our body. And the fourth one is place for mineral storage. This is known. Everyone is familiar with this. That means bone is the site for mineral storage. For example, calcium is stored in bone, and also other phosphorus also stored in bone, and also there is important for bone formation. And also bone is the site for blood produce. For example, the red blood cell, platelet, and the white blood cell also produced in bone marrow. When we come into our titles, introduction for fractures, fracture is the broken of bone. That means it is the breakdown of continuity of the bones. That means discontinuity of the bone. It is ranging from thin cracks to complete breaks. Bone fracture cause-wise lengths in several pieces or into many pieces. When it's fractured, it may be fragments or into many pieces. Fracture happens when bone is impacted by more force or pressure than the support. That means when a force is applied on the bone, it may cause for bone fractures. And also fracture is commonly happening because of maybe accident, force, and also sport is also cause for bone fractures. When we see types of fractures, the fracture has we categorize into many types based on source or size. For example, displaced and displaced fracture. When we say, as name indicated, displaced fracture is the fracture where bone is separated into two complete pieces, and also it may displace its original position. And also when we say about non-displaced fracture is incomplete fracture. That means where the bone is not completely separated, it is found in its original position. Other category is open fracture versus closed fracture. When we see open fracture, as its name indicates, open fracture is open. It is break down the skin continues in the out of the skin is, or open fracture is more prone or susceptible to infection because it is open. It is easily to exposure to infection. When we see closed fracture, it does not disrupt the skin integrity. It's not disrupt the skin integrity. It's not. It is inside the skin, but it's not break the skin continuities. Different types of blood fracture split partial or complete, as we see before. Transverse, the other classification is transverse fracture. Transverse fracture is, as name indicates, transverse. It is break is there is straight line across the bones. It is straight across the bones. That means longitudinal. Spiral, the other is spiral fracture. This happens when the bone is weak. Forcible rotation or twisted. When we twist it or rotate our linkage, it is possible that bone fracture. One of the causes of fracture is bone loss. So, when our link is twisted, it may cause bone fracture with types of spiral fracture. It is result in break where the bone is completely break into two. The other is green stick fracture. Green stick fracture is a type of fracture. It is incomplete fracture. That means the bone, the injured bone may be bent to the fractured part. This type of injury is most common in children. The other is comminuted fracture. Comminuted fracture is when the bone is broken down into many pieces. Bone is split or shattered into numerous fragments or into many pieces. The fracture is into above one or two fragments. What we call comminuted fracture. The other is oblique fracture. Oblique fracture is when the bone of fracture of bone is oblique. In the other one is impact fracture, when the break end of the bone are jammed together by force of the injury. The other is segmental fracture, composed of at least two fractures lined together isolated segments of bones. The other is depressed fracture. Depressed fracture is more, it is happening on our skull. The bone pushed inwards to our body. Often seen, as I said, in the skull, in the facial fractures is always maybe it's types of depressed fracture. The other is avulsion fracture. It is a break at the site where the bones attach to the tendon or ligaments. Avulsion fracture is a fracture where the site of the fracture is around the tendon or ligaments. As we know, ligament is when the two bones is connected in the tendon is the place where the bone and the muscle is joined. So when the fracture is around the tendon and the ligament, we call avulsion fracture. This is the picture which indicated types of fracture. The first one is normal fracture, normal bone. The second one is transverse. As I said before, it is transverse across the bone. Or the second one is oblique. We'll see. When we comes to the epidemiology of fracture, or bone fracture, injuries are common in the or increase in most developing countries. It is more common in what? Developing countries, including sub-Saharan Africa. The rate of injury mortality in African nation in 2004 was highest in Nigeria and the lowest in Egypt. The highest during this, highest in Nigeria and the very low in Egypt. South Africa and Ethiopia were second in the third respectively. That means South Africa is ranked, when we see in the rank, the second one in Ethiopia is found on third levels. Most trauma outcome study reveals that fracture is the commonest outcome of injury. For instance, of more than this much number of patients recorded in the major trauma outcome study in Europe, 48.6% had one or more musculoskeletal injury. In the United States, this 60 up to 67% of injuries that occur annually involve the musculoskeletal system. Fracture represents 25% of self-reported musculoskeletal injury. Over 60.2 million fractures are treated annually. When we come to the epidemiology of fracture in Ethiopia, according to Keble W.et.al. in Jimma, southwest Ethiopia, study done on the pattern of injury revealed that fracture was leading outcome of injury. This 454 or 41.2% On similar study done on interpersonal violence related injury at Sister Luke Hospital, Wadiso Town, Oromia region, in 2009 also revealed that fracture was commonest. This number, 2,257 or 67% of outcome of injury. And also according to a study by Haile Mikhail ET on magnitude and the outcome of road traffic accident at hospital in Walaita Soto, the principal outcome of injury was more commonly on the extremity. This much number, 300. The other is causes of fracture. We see about the technology of fractures. When we comes to the causes of fracture, we may categorize cause of fracture into three. The first one is trauma, the second one is osteoporosis, and the other is overuses. When we talk about the trauma is maybe due to fall, motor bicycle accident, or tackling during football game can all result of fractures. That more when someone is fall or by accident of motor bicycle, and also in football game maybe cause for bone fractures. That is osteoporosis. Osteoporosis is weakness of the bones because of what? Deficiency of minerals. This disorder weakness of the bone makes them more likely to break in the overuse, repetitive motion. ከአቅም በላይ ሁሌ ስፖርት እየሰራ ከሆነ ምን ያደርጋል? It may cause for bone fractures. When we see clinical manifestations of bone fracture, symptoms of fracture are intensive pain in oral. It is may have a pain, deformity, the limb looks out of the place, swelling, brushing, or tenderness around the injury, numbness in the tingling, loss of sensation, problems moving of limb, inability to move, muscle spasm, loss of function, guard against movements. Those are clinical manifestations of bone fractures. When we comes to the diagnosis, there are some ways we use to what we call diagnose fractures. First, history is very essential to diagnose the fractures, and also physical examination. X-ray to see the sites of fracture. CT scan is very important. For example, when the fracture is around the skull, and also magnetic resonance image, hematocrit or hemoglobin, because during this fracture maybe there is bleeding. Hematocrit is very important to diagnosis, and also serum calcium levels, because bone is the site of what? Calcium storage, as I said before, and also calcium is very important in bone healing. General management is when we comes into general management of fracture. First, stop it, bleeding or homostasis, and also prevent any movements. Immobilize, assess cold skin, because when the bone fracture, it may attack what? Nerve. If it attack nerves, there is no blood circulation. If it is attack blood vessels, there is no what we call blood supply. During that, where there is no blood supply, cold around the skin, and also numbness or loss of sensation due to nerve damage. Give support, cold compress, and elevate the parties to prevent thrombosis, and also anti-pain is very important to prevent or to relieve the pain. Principle of managing the fracture. When we see principle managing of the fracture, we may categorize into three. The first one is reduction. The second one is immobilization. The third one is rehabilitation. When we see reduction is restore fracture fragment to their normal atomic position. That means to restore the fragment bones to its original position. And also immobilization. Immobilization is maintain reduction. That means bone እንዳይንቀሳቀስ ማድረግ ነው ማለት ነው። Rehabilitation, promote reacting to normal function in the strength of affected part. ወደ ኦሪጂናል ፖዚሽን ተመለሰን በኋላ ኢሞቢላይዜሽን ከሆነ በኋላ ወደ ኖርማል አክቲቪቲ እና ስትሬንግሱ መመለስ ነው ማለት ነው። The others is when we see one by one reduction, methods of reduction, closed reduction and open reduction. Closed reduction, as the name indicates, is closed. Maybe it's used, we use what? Traction method. This is accompanied by bring of the bone fragment into a position by manipulation in the manual traction. Traction is the when marag inchiraden, redact marag inchiraden. X-ray is also very important to obtain to determine that bone fragments are correctly aligned to. The second one is open reduction through surgical approach. That one is surgical document reduct maragno. Fracture are reduced. Internal fixation. Fixation, as we know, we may use metal. Insert the bone in the immobilize the bones. This is the material which we use during open reduction. The other one is immobilizing. The second one. In immobilizing, we may use cast forces. It's a rigid external immobilizing device that is mounted to counter of the body parts. We may mount it around the fractures. It has its own purpose. The purpose is the first one is to immobilize the reduced fracture. The reduced fracture to immobilize the reduced fracture to provide support and stability for weakening the joint to correct deformity. Generally, it can be permit a mobilization of patient while restraining movement of the fracture parts. This one is a process of cast, as we see in the orthopedic part. There is a material which we use during the cast process. This is POP is one material we use during the cast process. This is saturated with powder anhydrous calcium sulfate or gypsum. When wet, crystallization reaction occur and the heat is deep of also then plaster or it is made from the fiberglasses. It is advantage. It is dry very quickly, light, weight, and may be immersed in water without losing the strength. When we immerse it with water, it is not lose its strength because it is made from what? Fiberglass or it is made from glasses. So it may reheat it and remanded if revision is needed. The other one is traction. Traction is may be used for reduction in the immobilization. When we see it is the purpose of traction, the first one is reduced the fracture. In the case of we use traction in reduction, and also maintain correct alignment of bone during healing. Immobilize the limb while soft tissue healing takes place in the correct deformity is one of those are the purpose of our traction. This is the way of we do traction. The last one is rehabilitation. Rehabilitation management for bone fracture. As I said before, it is reagain to back the individual to its original strength. Rehabilitation management for bone fracture typically involve comprehensive approach to help the individual regain strength, mobility in the condition after the injury. After injury, one individual to regain its strength, mobility in its normal condition. And also in this way, physical therapy is very important, and also pain management, nutritional support is very important, such as food which is rich in protein, calcium, and the vitamin is very essential to healing the wounds. So, in the case of rehabilitation, those nutrition is very important for individuals. When it comes to nursing intervention is one of our works. The first one is maintain bed rests, immobilizing, support fracture site with pillow in the folded blanket. In the case of immobilizing, it also prevent what? Thrombosis. Maintain natural position of affected part with sand back. Skin care because the patient is on the what? On the bed rest to prevent bed ulcer or to skin care is very important, and also psychological support is very important to prevent to relieve patients from anxiety. Education is very important. What we educate during a fracture, for example, how he care for himself, the advantages of wound care, and also the advantages of supports the fractures, and also educates some nutritional, which is facilitate the wound healing is very important to educate these patients. When we come to nursing management, first pain management is during the fracture there is pain, so we must manage the pain. Is administer prescribed pain medication as well by the healthcare provider to help alleviate the pain that promotes comfort. The second, as I said before, immobilization is very important during the fracture. Assist with the application of castis using castis, splint, or brace to immobilize the affected limb and promote proper bone alignment for healing. Educate the patients on the importance of immobilization and provide instruction of care and education. And the third one is nutritional support. As I said before, calcium, the food which is rich in calcium, protein, and also those food is very important to wound healing. So we administer this food is for the patient is, and also mobility assistance. Assist the patient is with safe mobility techniques. Because when he move, it may cause for reagain for fractures. So safe mobility is very important for fractured person. Transfer in the position to prevent further injury in the complication. Patient to transfer in the positioning is very important to prevent what? Further injury in the complication is provide guidance on the using assistive device such as crutch or workers and encourage gradual return to activity as directed by healthcare providers. The fifth one is psychological support. I said before, there is maybe anxiety related to fracture. So to relieve these patients from the anxiety, we may give psychological support for that patients. And also education is very important on what we educate is for those activity restriction, sign of complication, follow-up, appointment, and the care for instructions in educate the patients. Those are as the indication of the fracture. First, hemorrhage, because of bone is highly vascular. There is hemorrhage and also infection. If the wound care is not appropriate, it may cause for infection, especially open fracture. The other is thromboembolic complication because if we do not elevate the affected part, it may promote what? Thromboembolism, promote ያደርጋል. And the others is acute compartment syndrome, applied pressure on the facial tissue such as nerve, muscle, the internal part, facial tissues, and also fat embolism. Fat embolism is, as we know, air embolism, just like that. Fat embolism, fat is stored in what? Bone. When the bone is fractured, the fat is released from the bone and enter into the lung cavity and cause for fat embolism. These are